So, good afternoon to one and all. Again, we are here with two distinguished speakers in this webinar series. I welcome you all to the Homeopathic Learning Series hosted by BJ Publications under the domain of Homeopathy 360. So, as Henry Ford has rightly said, anyone who stops learning is old, whether at 20 or 80. Anyone who keeps learning stays young. So, today we are having these two young, dynamic speakers with us who are going to enlighten us with their experience that they are having and from whom we had learned lots of homeopathy. They are having vast experience in dealing n number of cases from various domains. They are not only, we cannot bind them in one specialty, whether it is organon, practice of medicine or psychiatry or any of the subjects. They are true masters, they are true practitioners. So today, first of all, we are having Professor Dr. Heena Rawal, Madam. She is Principal and Medical Superintendent HOD, Organon of Medicine from Ahmedabad Homeopathic Medical College, Parul University. She has been empaneled NABH and NAAC Assessor. She is PhD and PG guide at Parul University. She is the first speaker and she is going to deal with the subject Prelude to Hahnemannian concept of miasms and their clinical significance. And the second speaker that today we are having is Dr. Manoj Patel sir. He is professor and HOD Psychiatry Department, ML Dhawale Homeopathic PG Institute, Palghar. He is Director of Community Health Services at MLD MHI organization, Mumbai. He is Executive Director of Malini Kishor Sanghvi Hospital and Educational Complex, Gujarat. He is PG guide for students of psychiatry for MUHS University, Maharashtra, and he is going to deal with mental diseases. So I request both of them, I welcome both of them, and just guidance to the attendants that if they are having any questions, please mention it in the chat box. At the end of each session, we will address to these questions, means the speakers will address to their questions. And if there is any technical problem in terms of the whether the slide is blur or there is some sort of sound problem, whether you are not able to hear it properly, please check your internet connection and reinsert the microphone pin again, and please check it so that we can enjoy the learning session that we are having today. Today we have already covered 22 sessions. Again, two more speakers are with us. We are going to enjoy this learning feast. Today is Sunday and it is feast for us that two of the great experienced teachers are with us, and I hope that we will enjoy this session. So I request Heena Madam to please start with the session.
Yeah. Thank you, Yogesh ji. Thank you very much. A very good afternoon, and thanks for the compliment that me and Dr. Manoj sir are young. Maybe we are not by age, but by heart we are young, because both of us are working in colleges, and so staying with young students, and that is how we remain young at heart. So today is a very historical day. Today is Father's Day. Today is International Yoga Day. So my heartfelt greetings to all Indians as well as international viewers who are today watching us. The heartfelt greetings for Yoga Day. And we have today also seen the Ring of Fire, the solar eclipse, which we have witnessed. Now I start with my presentation. It is a prelude to Hahnemannian concept of miasms and their clinical significance. I'll start with my presentation. Now, to begin with, the classification of disease, which was done by Dr. Hahnemann, right? Now, as we all know that Dr. Hahnemann was strongly against the nosological classification of diseases, and before him there was many formal classifications of diseases which were done, starting from Felix Platter to Thomas Sydenham, and there were many other classifications, but Hahnemann did not accept any of these classifications because he believed that the man cannot be classified, especially the diseases which man suffered. That was an individual suffering which cannot be classified. So Hahnemann was against any formal classifications of diseases. But then just to simplify the work of a physician, just to make the work of a physician easy, he did a formal classification of disease, but the major difference was that before him or during his time, the book picture was applied to the patients. Whatever the classifications or whatever the nosologicals which were decided in the book, and for that the specific medicines were decided. So the book picture was stamped to the patient. Hahnemann did just the opposite. He, instead of stamping the book picture to the patient, he made a very broad classification. Whatever the patient presented in the clinic, he classified those signs and symptoms, he classified those diseases. So it was completely just the opposite which was followed for centuries, because the first classification was done in the 16th century. So the classification which was followed for centuries, Hahnemann just did the opposite. Whatever presentations, whatever symptoms the patient came to the clinic and presented, those symptoms he applied to the book. So therefore he made a big classification, a broad classification, and his classification is popularly known as the clinical classification of disease, because the presentation in the clinic was applied. So it was known as the clinical classification of disease, and he classified disease into two big groups according to their presentation. Either the disease was acute or the disease was chronic. That is how it was presented in the clinic. But before that, before the dynamic diseases, just again to simplify and nothing is ignored by the physician, he said that many a times it is just not disease, but it is indisposition, or it is also a surgical condition with causa externalis. So the next one is the indisposition. That is the slight transient feeling of unwell with one or two trivial symptoms. Now, if we go to Organon, we'll find that indisposition is mentioned at three different places. The first time the word indisposition comes in the footnote of the seventh aphorism. In the seventh aphorism, Hahnemann has explained causa occasionalis, the cause which gives an occasion for the disease to be produced and progress. So that was the first time. And there he says in the footnote that these causa occasionalis sometimes produces just indisposition. That is, it is a maintaining cause which is responsible for indisposition. That is a transient feeling of unwell with one or two trivial symptoms. Now, there he has given examples that if there is a tight bandage, and that bandage on a wound will cause pain, which will cause discomfort, and the patient is feeling miserable. But here, this is just an indisposition. You loosen up the bandage and the patient is fine. He has given an example of the imperforated anus in a newborn baby, which will not allow the meconium to pass, and because of that there is discomfort, there is distension of abdomen, the baby is cranky, crying, and you just perforate the anus and all the signs and symptoms will disappear. Many such examples are given in Organon, and that is the place where for the first time indisposition is mentioned. And why it is mentioned, Hahnemann wants to emphasize that these are the conditions where a medicine is not required. You don't require to give a medicine. It can be rectified with just a little change in the diet and the regime of the person. It is unnecessary use of medicine is not at all advocated in such indisposition. Secondly, it is mentioned in this classification just to tell that it does not require medicine. They are not the real diseases. The vital force is not deranged. It is just the mimicry of sickness. It is not real sickness. And then it is again mentioned in aphorism 150, where Hahnemann talks about the homeopathic specific medicine. And when you have given the homeopathic specific medicine for a chronic disease, and the medicine is working, the patient is feeling better, you are not repeating the dose, you are not giving the second prescription, and day by day the patient is improving. But during that period, if the patient comes with one or two trivial symptoms, either because of an exciting or a maintaining cause, and where the patient has just a slight feeling of unwell, then don't interrupt the action of the similimum which you have given, because this is just an indisposition. By little changes in the mode of regime of the patient or in the diet of the patient, this indisposition will pass off. So indisposition he has mentioned at 3 places in Organon, and this is mentioned in the classification just to differentiate between the dynamic diseases, the real diseases, and the mimicry of the disease, that is indisposition. Then the second part in the classification, that is the taxonomy of the diseases, the second part, that is surgical diseases with causa externalis. Now you must be aware that surgical diseases are mentioned at 2 places in the classification of disease. One is at the beginning, and another time it is mentioned in one-sided diseases, that is chronic diseases. But this is a differentiation, that again this is a condition where the dynamic homeopathic medicines might not be needed. These are the causa externalis. As the name suggests, it is a cause which has acted from outside on the body surface, and it has produced a lesion which is not severe enough to affect the vital force, which has not affected the vital force. It is a mechanical condition which is acted from outside. Say, for example, the students are working in the laboratory and they drop HCl and there is a mild burn on the finger. Or say, for example, there is a roadside accident and there may be a fracture, or there is a blow of a stick and there may be a fracture, there may be an abrasion, there may be laceration. Now see here, all conditions, the cause has acted from outside. These are the mechanical causes, as the name says, causa externalis. And when the cause has acted from outside, the internal medicines might not be required. It is just again that you need to use the mechanical modes of treatment to remove these conditions. Like as I said, that if there is a fracture, then you need to give a plaster. If there is a wound or if there is a burn, then you need to apply the ointments or you need to apply the sutures, whatever is necessary. So according to the condition, according to these conditions, the treatment is to be given. And then the next is the real dynamic diseases. Now see, here we come to the third classification, the third part of the classification of disease, that is the dynamic diseases. As the name suggests, dynamic means the dynamic derangement of the vital force has taken place. It is just not signs and symptoms which are transient. It has not affected the person as a whole. It's not like that. It is a condition where the person as a whole is affected. The internal vital force, the central life principle has been disturbed. And so these are the dynamic diseases which requires the use of dynamic medicines instantly. So this is the broad classification now which we come, the acute diseases and the chronic diseases. Now here Hahnemann has right in the beginning, that is if you read the aphorism 73, right in the beginning, he has classified that there is a sudden onset, there is a very, very rapid progress in acute diseases, and there is a tendency to complete the course either into recovery or death. The period of prodrome is very rapid. The period of progress is also very, very rapid. But then there is a period of decline. Either the patient gets cured or the patient may die also. But there is a tendency to complete the course. While as in chronic disease, the onset is very insidious, imperceptible. The progress is very, very slow, and there is no tendency to complete the course. To further simplify the work of a physician to select the medicine, in the clinical classification of disease, Hahnemann has further subdivided acute diseases according to their causative factors and according to their manifestations and according to the area where they are localized, the area where they affect. Now, these acute diseases are classified into the individual acute disease, the sporadic acute disease, and the epidemic disease. As the name says, individual means they are the isolated instances of sickness. One person getting affected in one area, another person with another disease getting affected in another area. More or less, these are the sudden explosion of latent sora when the person is too much exposed to the exciting causes. When a person exposes himself repeatedly to an exciting cause means anything in excess. It can be anything in excess: overheating, over chilling, overeating, over drinking. Not only that, abstinence from the nutrients which are necessary for maintenance of health, over dieting, over hunger, keeping yourself hungry. So it's not just overeating, it is abstinence from the things which are necessary for maintenance of health, which are necessary, which are needed. So excess in any form, dissipation, debauchery, all these are the causes of individual acute disease. The next is the sporadic. See, acute diseases, we are not going into the more detail because there are so many examples which are given in Organon, as we are going to concentrate more on the chronic disease. But just to make the classification clear, the sporadic diseases, again, as the name says, sporadic means scattered here and there. They are not in one place. The signs and symptoms may be similar, but they are scattered in different areas, different places. And as said in Organon, these are the diseases which are due to the telluric and meteoric causes. The common diseases from which mankind is recently suffering, many diseases have become sporadic because of the meteoric and telluric causes. Meteoric means which is related to the heaven. Meteor, it means change in atmospheres, change in climate, sudden heat waves, sudden hurricanes. See, nowadays we see that there are so many sudden hurricanes which are coming to different part of the world. It can be change in the atmosphere, and the most commonest which mankind is facing nowadays, that is pollution. We heard that because of the lockdown, the Himalayas can be seen from say 300 kilometers away, or the lakes, the bottom of the lakes could be seen. Now see, this is the pollution in which we live. So these are the meteoric causes, the atmospheric changes, the climatic changes, the thunderstorms, the hurricanes, and the pollution which is very common nowadays. And the telluric causes which is related to the earth, which is related to the ground, the food which we eat, the grains, the vegetables, the plants, which are full of insecticides, pesticides, and which are causing sporadic diseases. The water which is polluted, which is containing lots of impurities, and which are responsible for many sporadic diseases. So Hahnemann says that the second type of acute diseases from which mankind suffers are the sporadic diseases due to the meteoric and telluric causes. And then if a sporadic disease occurs in a close compact mass of people, then this sporadic disease gets converted into an epidemic. Epidemios, again, as the name says, it is general. The meaning of the word epidemios is general, affecting many people at the same time with the similar symptoms in the same area and more or less the same cause. So that is the epidemic disease. Again, the causes are meteoric, telluric, and along with that, as mentioned in Organon, the calamities of the war and the natural calamities. Calamities like famine, inundation, that is floods, which is mentioned in Organon, and all other war calamities, man-made calamities. So when a sporadic disease occurs in a close compact mass of people, it can become epidemic. It can affect many people at the same time. And when an epidemic disease remains for the entire year, then it becomes endemic. The sporadic disease, when it starts in a close compact mass of people living in congested areas, in slum areas, then it can become epidemic. When the epidemic disease is prevalent for the whole year, then it is called as endemic disease. Again, as I told you, that it can be a telluric cause. Goiter is very prevalent in the hilly regions. Why? Because the iodine is not, it is less iodine is there in the soil. And so people suffer from goiter throughout the year, a cause which is a telluric cause. Or say, for example, in West Bengal, malaria is endemic. Too much of rainfall, marshy areas, and therefore it is a meteoric cause. High rainfall, heavy rainfall, and marshy areas. Because of that, congestion of water at different places, more mosquitoes breed. Secondly, their staple food is fish, and so they have small ponds in front of their houses also, and where they breed fish, and therefore with the fish there is mosquitoes also, and therefore malaria has become endemic in West Bengal. Filariasis has become endemic in Puri, again because of marshy area, sea coast. So the meteoric and telluric causes, when they affect the person or the people or the population for the entire year, then it is called endemic. And when majority of the countries of the world are affected by an epidemic, then it is known as pandemic. The word which is most used nowadays, the word pandemic, which before 6 months, many people might not be knowing what is pandemic, but now everyone, illiterate person or a small child knows what is pandemic. So when majority of the countries are affected by an epidemic disease, then it is called a pandemic. Very famous, the COVID-19. Before, when we taught Organon, to give examples for pandemic was difficult, but now everyone knows that this is the condition, this is the prevailing condition, and by which mankind is troubled like anything. So when the epidemic prevails, or when the epidemic affects the majority of the countries of the world, then it is known as a pandemic disease. So these are the different classifications, sub-classifications of acute diseases, which Hahnemann has given in Organon. Before so many years, he had understood disease, he had studied disease, he had seen the clinical picture of the diseases, and according to the clinical pictures of the diseases, he had classified. So the individual acute disease, the sporadic acute disease, the epidemic, the endemic, and the pandemic acute diseases. So this was the classification according to the clinical features of the acute diseases. Now we come to the theory of chronic disease. Now, as I say, that after 30 years of practicing homeopathy, that is right from 1790, the famous experiment with cinchona bark, to 1820, Dr. Hahnemann observed that though the disease appeared to subside for a while by properly selected homeopathic medicines, they had a tendency to relapse at some future time. Recurrence, and how it relapsed? Either there was recurrence of the same symptoms at intervals. The patient kept on coming back again and again with the same symptoms at different intervals. Sometimes the patient came within a week. Sometimes the patient came after 2 months. Sometimes the patient came after 6 months. But the patient kept on coming. Or it happened that the condition did not subside. The condition went on aggravating. There was the aggravation which was taking place again and again. And every time when the patient was coming, the intensity of the symptom was increasing. Or it happened that the patient never remained well. He came with different symptoms. The symptoms kept on changing. Say, for example, once he came with cough and coryza, or say common cold. Then again, after a few days, he came back with some diarrhea or some dysentery-like symptoms. After a few days, again the patient came with disturbance in the digestive system. After a few days, again he came with burning micturition. But see, the patient was not well. Something or another was happening to the patient, and the patient came back again and again with the same symptoms or with different symptoms. He kept on coming. Now, this was the condition. Hahnemann practiced homeopathy for 30 years. As you must be aware that in the 4th edition of Organon, the theory of chronic disease was produced. It was written for the first time. It was published. Now, the theory of chronic disease came in the 4th edition of Organon, and as you must be aware that the 4th edition of Organon was published in 1829. Hahnemann started practicing, or he did the famous experiment with cinchona bark in 1790, and finally he was able to coin the theory of chronic disease in 1829. So it almost took 39 years. And that is a big period. Sometimes many of us will end our career in this 39-40 years. But he took such a long time because he realized that in his practice, there were some patients, because if we are talking about the prelude, because when Hahnemann came to the theory of chronic disease, before that, what he had experienced. Now, in this long period, what happened that Hahnemann realized that in certain patients he was very successful. He gave the medicine and the patient was more or less rapid, gentle, permanent cure took place. But in certain patients, no matter whatever he tried, the patient, as I told you, kept on coming back again and again with some complaint or increased complaint, but the patient was not well. Now, this compelled Dr. Hahnemann to think that why this is happening. Why the start was very pleasing, the continuation was very less favorable, but finally the outcome was helpless. This failure of radically curing certain diseases, he thought may be due to some reasons where I'm going wrong. See, he brought some of his followers who were practicing homeopathy and who were facing the same difficulties. He brought them together and he thought that someplace, somewhere we are going wrong. And because we are going wrong at some place, we are not able to get the cure, the ideal cure, the desired cure in all our patients. And therefore, our mission is not fulfilled. To restore the sick to health, that is to cure, is not fulfilled. And then he found out that maybe we are committing mistake at 5 places. After thinking, after discussion with his followers, his friends who were practicing homeopathy, he thought that maybe we are committing mistakes at 5 places. And those 5 places he thought was, the law of similia is not universally applicable. The number of drugs hitherto discovered were insufficient to cover all varieties of disease conditions that afflicts human beings. Might be defect in the application of law of similars, might be omission in ascertaining the totality of symptoms, or it might be an obstacle whose persistence and non-eradication is resisting lasting recovery. See, these were the 5 reasons, 5 things which he thought that he might be going wrong at any of these 5 places. And so one after another, they took up this for discussion. And in that discussion, they found the first thing, that is, the law of similia might not be universally applicable. Now, this point was discarded because, as we all know, that the law of similia is not a law which was formulated by Dr. Hahnemann. It was a nature's law. It is a universal law. And when it is a nature's law, it is certain, it is fixed. It does not change from time to time. It does not change from place to place. And to scientifically prove it, the law of nature was based upon the inductive logic. The inductive logic, which was first time formulated by Lord Bacon and was published in his book Novum Organum. And Dr. Hahnemann was highly impressed by Lord Bacon and his Novum Organum. And therefore, when he wrote his Bible on homeopathy, he used the word Organon, because he had taken this word from the book Novum Organum. And till then, till Lord Bacon, he was not a doctor, he was not a medical person, he was a British philosopher. But he was the first person who said that don't just ask questions, but for the questions, find out a rational answer also. And that is what he had taught in induct, because see, as we know that before that, in the 16th century, 15th century, man had miserably failed to understand disease and death. And when man could not understand disease and death, then the demonic concepts came, the supernatural concepts came. That why person are dying in chronic diseases also, you read that people believe that it is a demon, and because of that people are dying because of cholera. Even in our country, for smallpox, it was considered to be, there was a supernatural concept for the causation and death due to smallpox, many such diseases. So Lord Bacon was the first one who introduced inductive logic and the steps of inductive logic. There are different types of ways of practicing inductive logic. But the basic steps for inductive logic is, the first necessary thing is, there is a premise, there is a fact, there is a phenomenon, a natural phenomenon, or any fact, a natural fact. The first step is exact observation without any prejudice. That is what is Hahnemann also built up Organon in the same way. He built up homeopathy in the same way. And in finding out homeopathy, he used the same thing. Without any prejudice, exact observation of the facts and the phenomenons. And just to see, it's not just looking, it is observation. You use all your five senses and you see or you look so critically that your observation goes correct. And when the observation goes correct, then a correct interpretation comes, a correct understanding of the facts and phenomenon comes. And when a correct understanding of the facts and phenomenon comes, then the correct interpretation comes. Whatever you have observed, whatever you have seen, you interpret it rightly. Hahnemann had observed that cinchona bark juice, when taken, was producing malarial-like symptoms. And when it was stopped, the symptoms disappeared. And so he understood that cinchona bark juice cures the ague fever because it has got the capacity of producing the ague fever, the symptoms like that of ague fever. So that is the correct interpretation. A patient comes and tells you that I feel that as if there is something in my abdomen. You ask more questions, and then the patient tells you that I feel there is an animal. Then you ask more questions, and then the patient tells you that I feel that there is a living animal in my abdomen. See, the correct observation, listening to your patient, and then interpreting what the patient feels. So that is a conception. Hahnemann has written in the third aphorism, the physician has to perceive. He has not written the physician has to look, or the physician has to observe, or the physician has to examine. He has written the physician has to perceive. Perceive is a combination of observation, interpretation, and a conception being formed in your mind, a theory being formed in your mind, and your mind before that must be free of all prejudice. So the second step of inductive logic is correct interpretation of the observed facts with a view to understand them in relation to each other and to their cause. And then whatever you have understood, the concept which is developed, it should be rational enough to satisfy the intelligence of one and all. The explanation or the theory which you are giving, or the scientific principle which you have formulated, that should satisfy the intelligence of everyone. And that is called a rational explanation of the facts. Similia similibus curantur. So that is a rational explanation which you are giving. It should not be without any reasoning. There should be a reasoning. And then whatever explanation, whatever principle which you have constructed, which you have formed, can be experimentally verified. There must be experimental verification. Now see, these were the different steps of inductive logic. Now Hahnemann argued that inductive logic, on the inductive logic, the law of similia, as I gave you the examples, the law of similia was formed on inductive logic. It was observed, it was rightly interpreted, it was rightly explained, and with experimental verification, again and again, it was verified. Because in 1790, Dr. Hahnemann did this experimentation, and in 1796, he published a new principle to ascertain the curative power of medicines. He published in Hoeflin's journal. That is, he took 6 years. And in those 6 years, he experimented almost 50 times. So there was an experimental verification. Not only that, the law of similia was deductively also proved to be correct. Now say inductive logic or a deductive logic. Either you go from the generals to the particulars, or you reason or you infer from the particulars to the general. There are two ways of coming to the same conclusion, that is the truth. That is the premise, the correct, the fact. Either you reason from the antecedent, from the beginning to the consequence, coming to the end, or you reason from the consequence to the antecedent, that is deduction. Both way, what you arrive is at the truth, at the fact. So the law of similia, when applied again and again and cure taking place, then it is a deduction which is taking place. From the particulars, you are coming to the generals. So law of similia is not to be doubted. That part, that reason was discarded, because the law of similia is universally applicable. It is a nature's law, and it has been experimented. It has been proved with the help of inductive and deductive logic. Then the next point, which they thought, that the new additions of new proved valuable medicines over the years had not advanced the healing. Now see here, Hahnemann, right from the beginning, he said, he discarded this point, saying that this is an excuse. This is an excuse. Why? Because every year the number of proved medicines at that time were increasing, because many of his followers, many of the people who were practicing homeopathy, they were proving more and more medicines, and they were increasing the materia medica pura. But though the increase in the materia medica was taking place, but not by a single step, the improvement in the patients where they were failure was increasing. Even when the number of, before 10-15 years, when the number of medicines were less, they were not able to cure certain patients. Even when the number of medicines increased, they were not able to cure them. So the increase in the number of medicines every year in the patients where they were failure before, they remain failure. In the patients where they were successful with less number of medicine, they were successful, even when the medicines were less. So right away, Hahnemann discarded this point, saying that the number of medicines had nothing to do, they were not insufficient, had nothing to do with their failures. Then the law of similia is not universally applicable. Now see, in the third aphorism, Hahnemann says, he talks about the knowledges of the diseases. He talks about the requisite qualification of a physician to become the true practitioner of the healing art, what qualifications he should have. And there he talks about the knowledge of disease, the knowledge of medicine, and the third is the knowledge of application of the knowledge of medicine to the knowledge of disease. And there he says, he's not saying that select the remedy, select the homeopathic remedy, the similar remedy. He keeps it open that the mode of application can be similar, dissimilar, or it can be heterogeneous. Because the fourth point is selection of the homeopathic medicine, similar medicine. The third is application of knowledge of medicine to the knowledge of disease. So you can apply it on the basis of similarity, dissimilarity, or heterogenic, neither similar nor dissimilar. But then, just to prove that how similarity cures and why similarity cures, he has brought mighty nature as an evidence. In aphorism 34 to 42, he has described that naturally also when two dissimilar diseases come together, if the new coming disease is weaker, then it is not able to affect the body. It is repaired by the older disease. He has given examples for that also. If the new coming disease is stronger, then it will suppress the weaker existing disease and run its own course. After its course is completed, the weaker existing disease will again start to run its course. And if they are of equal strength, both are chronic enough, then they'll get localized to a part or an organ to which they are the best adapted and run simultaneous courses, forming a complex disease. So he is bringing nature as an evidence that when two dissimilar diseases come together, there can be repulsion, there can be suppression, there can be forming of a complex disease, but not cure. And then if two similar diseases come together, from aphorism 43 to 49, he has explained that if the two diseases naturally come together and if they are similar in their manifestation, different in kind, then the weaker one is permanently extinguished by the stronger one. Permanently extinguished by the stronger one. So even mighty nature, when they are similar in manifestations, he has given example of chronic ophthalmia being permanently cured by an attack of smallpox, because ophthalmia is one of the symptoms of smallpox. Tumification of the upper arm permanently cured by an attack of cowpox, because tumification is one of the manifestations of cowpox. So he has given so many examples of orchitis and smallpox, deafness and smallpox. So many examples he has given, and he has stated that when they are similar in manifestation, the weaker one is permanently extinguished. So the mode of application which they were using, that is similarity, is not to be questioned. And so the third point was again discarded. The third point which they thought that this might be the reason, they did not consider it. Now, what Hahnemann sir did, that he took up all his cases for reinvestigation, for restudying, and he found that every time when the patient was coming to him, the patient was coming with varieties of symptoms, and every time he thought that the symptoms though appeared new, but it was a complete disease process which is going on for years together. It was a symptom syndrome which was going on for years together. As rightly explained in aphorism 72, he has explained the disease per se. That is the dynamic derangement, slow, gradual dynamic derangement of the vital force, which after the internal complete derangement is coming to the external surface in the form of signs and symptoms. But before that, the complete internal derangement of the person is taking place. That is disease per se, that first the preservative property, the vital force is a never resting preservative force. So first and foremost, the preservative property of the vital force is disturbed. After the preservative properties, later on, there is the sensations become abnormal. The sense of well-being is replaced. The feeling of unwell comes. The disease comes. The feeling of ease, well-being, comfort goes. Now see, this is very, very beginning. And after that, the change in functions comes. So after the change in sensation, And then the change in function comes, and when the change in function comes, you feel that yes, this is the disease which has started, and then comes the structural changes which are initially reversible, and later on, if the disease is not controlled, if medicines are not given, or if the norms of life are not followed, then comes the irreversible structural changes. But this is a disease event which is going on for years together. So Hahnemann realized that the simple instances of any attack of a disease and with which the patient was coming to him, and he was treating them as single episodes, actually were not single episodes. And it was a complete syndrome, a symptom syndrome, a whole scenario which is going on for years together. And so he realized the totality of symptoms should include the series of events, and a medicine to conquer the acute symptoms and underlying chronic sickness must be administered. He realized that he was not adding the past history in selection of the medicine, and that was the place where he was going wrong. To select a medicine which covered the past and the present history, then only the entire sickness can be cured. See, this is the first fallacy, the first mistake which he realized. That where he is going wrong because he was selecting medicines on single attack, single episode. Whenever the patient was coming, whatever was his presentation, on that presentation, he was finding out the similar and he was giving it to the patient. But actually, it was a disease which had started when he investigated the case right from the beginning. He realized that when he included, see, this is the part which he found, that his totality of symptoms was not incorrect, but the totality of symptoms which he was following was incomplete. Why it was incomplete? Because the past history was not added. And in the past, there were evidences, and it was possible to find out a medicine which covered the previous incidences as well as the present. So that was the first mistake which they found out, or the first deficiency which they found out, why they failed in curing certain patients. And then again, as I said, that he investigated the cases right from the beginning. And in every patient, he found that an obstacle which after it had advanced and developed to a certain degree cannot be eradicated by the strength of the robust constitution or wholesome diet or following the norms of life, or can die on its own. See, he realized that there was a skin eruption or a mild vesicular eruptions which either they went away in the past. There was a complaint of a skin which either went away on its own, or it was suppressed with the help of local applications. But this, he realized that this is which is acting as an obstacle, which is acting as a hindrance, and which is not allowing the cure to take place. This is something which is coming in the way of the cure. Now see, this is the time, if you know that in the 5th edition of Organon, Hahnemann has explained the vital force. But in the 4th edition of Organon, where he has explained chronic diseases for the first time, he has also explained as a central life principle. He has not used the word, we say that in the 5th edition, the vital force concept came. But the word vital force is coined in the 5th edition, but in the 4th edition, if you read, it is mentioned as the central life principle. Now, after he found homeopathy, he started practicing the law of similia. He started finding out a similar medicine. Being an allopath, initially he was using large doses. Then he started realizing that these large doses were causing certain ill effects to the patient. So first and foremost, he practiced the law of similia. Later on, being an allopath, he was using 4-5 similar medicines together. Again, he realized that when 2 or 3 substances came together, they lost some of their original properties, or they produced some unwanted properties. So he started using one medicine out of all those 4-5 similar medicines. He started finding out the one which was most similar. And that is how he started practicing the law of simplex. And later on, he was using large doses. He started using, he used his knowledge of chemistry, and he started reducing the quantity of dose. And that is how, with his knowledge of chemistry, came the methods of trituration and succussion. And in that, the dilutions, and so this is how he started reducing the quantity. Now, and he started following the law of minimum. But when he started doing this, when he reduced the quantity, at certain level, Hahnemann realized that now my medicines have become where the material quantity, the quality has increased. They have become qualitatively, they have become very potent. But quantitatively, they have become less and less and less. And it came to a point that at that time, he came to a realization that my medicines have become immaterial, or the material quantity is very, very negligible. When dilutions, then he realized that the medicinal quantity is very negligible, or it's almost absent. Yet my medicines are acting upon the body weight of a person and removing, say he's suffering from a chronic condition, he's having say 25-30 symptoms, and it is removing all these symptoms also. And this made him think that action and reaction takes place on an equal plane, and therefore my medicines are acting upon something which is also immaterial. And in turn, this immaterial entity is removing the signs and symptoms and is curing the material body weight of a person. And this immaterial entity, initially he called the central life principle. And he realized that there is an obstacle, there is some condition which is upon this central life principle, and it is not allowing the central life principle to remain healthy, in turn to keep the body healthy also. So this is the first thing which he found out, that there is some obstacle which is not allowing the cure to take place. And this obstacle, as I said, that there was a former EACH eruption in non-venereal patients, and which disappeared on its own, or it was suppressed by faulty practices, because at that time also it was believed that it is an EACH mite. See, people believed that this is an EACH mite, a small insect which is producing itching, and because of that the signs and symptoms are produced. So there is a small EACH mite which is causing all these this itching, and after that everything had started. That is what Hahnemann realized. But when he came to this concept of central life principle, and he realized that there is an obstacle which is overcoming the central life principle, he realized that these small vesicles, these small boils which are producing the itching and the scratching, and which sometimes disappear on their own, this is not just a small local irritation, it is an obstructive symptom syndrome, which he called SORA, and which was the internal itch disease. See, he has described SORA as the internal itch disease. It is itching, of course, but he has used the word internal, which has affected internally. The central life principle has been disturbed. The harmony has been disturbed. And it has produced itching, scratching, but it is a disease. See, when he is using the word disease itself, it means that it is the dynamic derangement which has taken place of the entire man. The internal derangement has taken place, and the man as a whole has started suffering. So this obstacle, initially he called it SORA. And he gave this name the soric miasm or SORA. Now, this is how he came to this concept of miasms, the theory of chronic disease, that there are two places where we are committing mistakes, that the totality of symptoms does not include the symptom syndrome, and there was a miasmatic block or an obstacle which was not allowing the cure to take place, and so the anti-miasmatic medicines must be found out and must be administered. Then and then the cure will take place. And that is the time after which he started proving the anti-psoric medicines. So this is the beginning, that this is where he felt that this is the internal itch disease, which is wrongly considered to be just the vesicular eruptions on the surface of the skin. Now coming to the three miasms, the first we begin with Sora, and as you know that it is a very ancient terminology. It is found in the Hebrew language. It was known as Sorat initially. It is found in the Greek and Latin also, the derivations are found. And the different dictionary meanings of Sora was, it is a groove, a fault, a stigma, or a pollution. See, everywhere it suggests it's a groove in the health of the person. It's a depression. It's a groove means it is a depression. It is a fault, something going wrong in the health of the person. It is a stigma. Stigma means which is something which is very bad, a bad name, which is going to remain with you for generations to come. That is a stigma, a taboo, which will remain with you for generations to come. It is not that in one life it can be removed. Or it is a pollution, it is toxic, it is not allowing the person to remain healthy, not allowing the person to remain pure. So in different languages, different meanings, dictionary meanings of Sora, but the suggestion is the same. Now, according to our Organon, Hahnemann has described Sora as the original disease condition. After complete internal destruction of the whole organism, is announced by peculiar cutaneous eruptions or few vesicles, accompanied by intolerable voluptuous itching, the primary manifestation of Sora. That it comes in a very, very mild form nowadays, that there are some vesicles. Vesicles are there, small eruptions which are with redness and with intolerable itching, voluptuous, which cannot be satisfied. The more the patient scratches, the more he wants to scratch. It can result into burning and bleeding also, but the patient wants to scratch. So there are few vesicles with a transparent fluid which can ooze out from them. So this is the primary manifestation of Sora, that it comes in a very mild form. And according to, if you see the evolution, what Hahnemann has written in chronic diseases, that initially Sora was coming in a very dangerous form, not in such a mild form. If you read chronic disease, Hahnemann has described that initially Sora was manifested in the form of malignant leprosy. And this form of malignant leprosy of Sora was so severe. It was so disfiguring. The patient was disfigured. The looks were horrific. And so the patient was not allowed. It was considered to be a stigma, a taboo. And the patient was not allowed to stay in the society. The patient was thrown out of the town or the village. Because it was coming in such a, that wounds, because of leprosy, the toes and the fingers, the eroding of the nose, and then the wounds which was suppurating, bleeding, the dirty smell. So the patient was not allowed to stay in the society. The patient was thrown away, and so the patient remained away from the population. They were sent to the caves or the forest, or they were allowed to die outside the village. Then gradually Sora started coming as the advancement took place. Sora started coming in the form of erysipelas, where it is mentioned as Saint Anthony's fire. It was coming in the form of erysipelas, which was redness, too much of redness, the eruptions on the entire body, with lots of burning and lots of scratching. So it was like a fire, and Saint Anthony's fire, it was to test the sin of a person. So it was known as Saint Anthony's fire. So it was coming in such a severe form. Lots of burning, irritation and redness. and that was a very severe malignant form of sora. Gradually, when cleanliness came, people became aware about cleanliness as civilization came, and the use of cotton, cleanliness, linen, all these started. So sora became milder and milder and milder, and it started coming in the form of just small eruptions or vesicles. But when sora became milder, it was very easy to hide that form of sora, and people started staying with the society, and this is how sora became more infectious and more widespread and more universal, because it was the people who was suffering from a soric vesicular infection was also easily mixing with the other population, so it became more widespread. Now these are the different denominations which are used in Organon to describe sora, or in the chronic diseases written by Dr. Hahnemann to describe sora. The other two miasms are venereal miasms, that is sexually transmitted. Sora is a non-venereal miasm. It is prima causa morbi, that is the first cause of disease. It is also hydra-headed, because hydra means it is a sea creature. You cut off the head, it can regenerate. So Sora, Hahnemann has said that it is hydra-headed because if you remove or you suppress one form of Sora, it can come back in numerous forms. It can affect each and every system of your body. So it is hydra-headed. As I said, that it is the most dangerous because it can affect everywhere and anywhere in your body. So it is the most dangerous, yet the most misapprehended. The primary manifestations of sora are so very mild that people are not scared of it. Say, for example, if it is a syphilitic manifestation, if there is an ulceration on the genitals, the people will rush to the doctor, or the person will be worried that what has happened to me. But when a small vesicular eruption, which can go away with a local application or on its own, then the person is not worried. So it is coming in such a mild form that it is misapprehended, misunderstood, but it is the most dangerous. As I said, it is the mother of all chronic diseases. All chronic diseases starts after sora. It is responsible for 7/8 of the chronic diseases, and the remaining, again, there is a combination of sora with the other miasms also, which under different circumstances evolves into various other diseased conditions affecting diverse tissues and organs, causing under different nosological labels. The nosological labels can be different. Many diseases, sora is in the background or sora is responsible. But sora alone, not complicated with any other miasm, that is syphilitic or psychotic, cannot produce any functional changes. Any structural changes. If sora is not complicated with the other two miasms, then it cannot produce structural changes. It is responsible only for the functional changes. Now, how sora advances or how sora progresses? As I said, that the primary manifestation of sora is just the vesicles which appear, which are at a very localized spot in a very small areas in the beginning initially. That is the primary manifestation of sora. With the faulty use of local ointments, strong ointments made up of caustics or made up of acids, and or nowadays made up of steroids also, then this manifestations of sora will be suppressed, but it will go in a latent form. It will be dormant, it will be sleeping. And these are, at that time, you get the manifestations of the latent sora. The patient cannot pinpoint that from what he is suffering. There is no nosological label which is coming at that time. But the patient is feeling dull, the patient is not feeling hungry, The person says that I don't feel hungry, but if you investigate that person, there is nothing. Or I eat a little and I feel full. I don't sleep as I was sleeping previously. I don't get my sleep. I don't get a sound sleep. Or I wake up every time at 3 o'clock in the morning. See, there will be mild changes where you cannot name a disease, where it cannot be pinpointed, but the patient is not well. He says, I don't feel like working as I used to do, or I get tired, I don't feel like working. So the nosology is not there, but sora is in the latent form, it is in the dormant form. And if the person is exposed to any exciting cause, the explosion of latent sora takes place and there can be acute manifestations. But say, for example, these acute manifestations are also repeatedly suppressed, then the secondary form of sora comes, where the functional changes will start. Now you can pinpoint, now there is nosology, you can name that the patient is having so and so symptoms, the patient is having urinary tract infection again and again. So the allopathics believe that there is pus in the urine, pus cells in the urine, and so the person is having urinary tract infection. But it is just the opposite, that because now the secondary stage of sora has started and therefore the symptoms are coming back again and again. Now at this stage again, if the symptoms are suppressed or not properly treated with an antisoric medicine, then sora reaches at the tertiary stage of sora, and where the structural changes will take place. Now the structural changes will take place. The structural changes initially will be reversible. If not treated properly, then they can become irreversible. So this is the thing, that this is how the entire soric miasm will advance. Then the second miasm which Hahnemann identified, and he used it to find out the antisyphilitic medicine and cure people, that is the syphilitic miasm, that is syphilis. Now see, again, this is, as I said, that sora was a non-venereal miasm. Syphilis is the venereal miasm. It is a venereal chronic miasm which is primarily manifested in the form of venereal chancre, which develops after impure coition. See, it is a venereal miasm, sexually transmitted miasm. Initially, we are talking about primary syphilis. And it develops in the form of chancre. As I said, the ulceration on the genitals. And after the impure coition, after the infection of the syphilis, on the 7th or the 14th day, little pustules may come up. And if these pustules are not suppressed with the help of local applications, then it can develop with a dirty looking, aggressive ulcer with raised borders, which is very painful, burning. And these ulcers, if they are removed with the help of cautery or some corroding local ointments, or they are being surgically operated or dissected, then after cauterization, it may develop into a bubo, it may get bigger, and which may start suppurating, which may again be suppressed with the help of cauterization or surgical intervention. And when this form of sora is again, it is suppressed, then it develops into the syphilitic miasm. And this syphilitic miasm then can affect the central life principle. Then it can cause the dynamic derangement of the vital force. See, this is the stage that first infection of syphilis due to an impure pollution cannot produce the syphilitic miasm. But the various expressions of syphilis are again and again and again suppressed. Then it can affect the central life principle. And it is the most destructive out of the three miasms. It can destroy not only the soft tissues but bony tissues and attacks the very life of an unborn child also, unborn child. If the husband infects the women and say the primary manifestations are suppressed, then there are repeated abortions, threatened abortions, missed abortions. So it can attack the very life of the unborn child because it affects the protozoon. The offspring is affected with the syphilitic trait. The child may be born with a hair lip. So it can cause destruction. Or the child can be born with the constitutional tendencies such as deformities, chronic catarrh conditions of the nose and throat, malformation of the teeth and of the bony structure, ulcers, etc. It can produce fissures, it can produce suppurations, deformities, destructions. It is a destructive miasms. So it's not possible to cover all the mental symptoms of all the three miasms, but I'll try to cover as much as possible, maybe later on with the cases also. So this is the syphilitic stigma or the syphilitic miasm. When suppressed, the syphilitic stigma spends itself on meninges of the brain and affects the larynx and throat in general, the eyes, the bones, and the periosteum. As I told you, it can produce destructions. And these are the predominant areas, predominant parts of the body where the destruction is produced. Like as I told for Sora, that it can go and affect everywhere. But these are the predominant areas where the syphilitic miasm will act. When the syphilitic miasm combines with the soric miasm, then it is the tubercular miasm. In the primary disturbances, the syphilis becomes grafted on this soric base. Here we have complications of trouble, just as each of the stigma is a problem itself. The union of two becomes more complicated. Many a times in this condition, the soric miasm is more predominant and the syphilitic miasm remains hidden. And therefore it is necessary that if you give the antisoric medicines in these conditions, then the patient can be easily treated. You begin with the antisoric medicines and then the patients can be easily treated. And the underlying, it may seem that the traits are of Sora, but it is very easy to diagnose the underlying syphilitic miasm because more or less these patients are not like Sora. They are dull, stupid, stubborn, morose, sullen. They are of the depressing type, of always sulking. So soric patients are not like that. Though the soric manifestations, physical manifestations are predominantly present, but the mental traits are of syphilis. And therefore, though it is a soric miasm, it is a combination of both, that is the Sora and syphilis. And so you have to start with the antisoric medicine and later on you can use the antisyphilitic medicine. So this is the tubercular miasm, which is also described as the problem child. The child born with the, Dr. H.A. Roberts has described it at a very extent lengthy, that how the child which is born with a tubercular trait with the syphilitic and soric miasm, and how it is the problem child. There is difficulty in reading, writing, understanding, comprehension, and so with the help of a medicine which matches both the miasm, or with the beginning the antisoric and then the antisyphilitic medicines, this child can be helped. Psychosis attacks the internal organs, especially the pelvic and the sexual organs. In this stigma, we find the worst form of inflammation, infiltration of the tissues, causing abscesses, hypertrophies, cystic derangements. When thrown back into the system by suppression, this stigma causes dishonesty, moral degradacy, and mania. See, psychotic miasm, again, just like syphilitic miasm, it is a venereal miasm, and it is a miasm which produces gonorrhea. It is the miasm which produces the gonorrheal infection, a mucopurulent discharge from the genitals. The first infection of psychotic miasm may not, sorry, the gonorrhea may not result into psychotic miasm. But say repeated infections of gonorrhea suppressed with the help of steroids or some other preparations, repeated infections of gonorrhea may result into the psychotic miasm, and which may be conveyed or transmitted by the husband to the wife and to the children also. The person, like say for example, the wife will contract it in the stage, means if it is not primary, then if it is the secondary stage by which the husband is suffering, then the wife will have the symptoms of the secondary stage. She will not have the gonorrhea. But say soon after marriage, she will start suffering from anemia. She may become dull, anemic. She may have cystic ovaries or fibroids in the uterus. So the secondary manifestations of the psychotic miasm will appear in the women after, if she is infected with this, if the husband is in the secondary stage, or the secondary psychotic stigma has already developed. So the gonorrhea might not appear, but these symptoms may appear. And same with the child also. So that is the psychotic miasm. Secondary and tertiary symptoms of psychosis also can be treated by the homeopathic treatment. It is not necessary that only if the gonorrhea was there you can treat it. We have got amazing medicines, and even if the patient comes to you with the affections of the psychotic miasm, the symptoms of the psychotic miasm, then you can treat this. And usually the psychotic miasm affects the blood, causes anemia, inflammation, rheumatism, and it can be easily treated with the help of antipsychotic medicine, again described by Dr. Roberts at a very extent, and with the medicines also. He has mentioned the medicines which are very useful as an antipsychotic medicine. So these are the three miasms by which Hahnemann has explained the psoric, syphilitic, and psychotic miasms. The different features of three miasms, you can get it from many books, and it is not possible to cover the manifestations or characteristics of all the three miasms as it is that I am supposed to do the prelude, and so I have stuck to it. But the three miasms can be easily differentiated by the different manifestations, right from the mental, the physical generals, the affections of the secondary manifestations, and that is how they can separate it. Now for each, with the king of anti-psoric, anti-syphilitic, and antipsychotic medicines, I have presented three cases. Now this was a person, a male who was 45 years old, and he had a complaint of dry, itchy skin with slight bleeding and burning sensation on scratching on both the legs below the knee and on the upper limbs since 1 year. There was aggravation by walking, winter, hanging the limbs down, morning, bathing, and there was amelioration in summer and warm application. Aching pain in low back since 3 years, having history of fall on back, and it was aggravated by lifting weight, stooping, or it was ameliorating by lying flat. The history of the presenting complaint was that the complaint had started 1 year back, and first it started on the left leg as a small eruption. Soon it started increasing, gradually spreading to the other leg and upper limbs too. Took various allopathic and homeopathic treatment, but it became worse and eruptions increased on upper limb. The lesion appeared with thin, watery discharge with bleeding, edema, and unable to make a step due to pain and burning in legs. There was aggravation by walking, cold exposure, hanging the limbs, and amelioration by warm application. In the past history, there was jaundice and chickenpox, and there was the history of fall and on the lumbar region 2 months back. And he had taken homeopathic as well as allopathic medicine, but there was no relief. In the family history, the father had suffered from heart disease, the mother had joint pains, and no other complaints in the other family members. The personal history, he was a graduate and he's a businessman. He has 2 children and he is a vegetarian. The generals are that his appetite was good, likes warm food and drinks, feeling of fullness in stomach even after taking small meals. Thirst was increased, likes warm drinks, desires for sweets, aversion to vegetables. There was a marked intolerance for pulses, and he said that usually he had a fight with the wife because mostly in the evening they had pulses. She cooked pulses, and he was not able to sleep properly because of that distension, and he had that feeling that it is not digested properly. In the mind, there was easily angered but sad on scolding, anxiety about the children, and financially. He was very much worried. He kept on talking about his children and the financial condition, that he was not earning enough. Then the physical examination, the patient had proper orientation, means physical examination, nothing abnormal was found, everything was normal. Then the skin examination, ill-defined margins, surface dry scales, nails no pitting present, bilateral pedal edema was present, and the signs were positive. The systemic examination, there was nothing abnormal detected. And the provisional diagnosis which was made was psoriasis. Differential diagnosis were psoriasis, dermatitis, or Lynchel teres. The investigation was again normal, nothing abnormal was found. Analysis of the symptoms. These are the patient's symptoms: easily angered and get sad on scolding, anxious about children, anxious about the financial matter, then easy satiety on taking food, desire sweets, aversion to vegetables, intolerance to pulses, sweet decrease, thermal reaction, heart patient, aching pain in low back, aggravated by lifting weight, stooping, ameliorated by lying flat. Disease symptoms: scaly offensive eruptions on both limbs, aggravated by walking, cold exposure, hanging limbs, and ameliorated by warmth. Evaluation of symptoms: mental general, easily gets angry and is sad if somebody scolds. Then evaluation of symptoms: physical general, thermal reaction, heart patient, thirst good, prefers warm drinks, appetite is good, desires sweet, aversion vegetables, intolerance to pulses and sweets decreased. Evaluation of symptoms, particular symptoms, these were the particular aching type of pain, aggravated by lifting and stooping, and ameliorated by lying flat. Common symptoms were scaly offensive eruptions on the body, lower limbs, and the aggravation amelioration as mentioned previously. The miasmatic diagnosis was all these symptoms were going towards psora. So the miasmatic diagnosis of psora. The totality of symptoms: easily angered, which I've already previously mentioned. So this formed the totality of symptoms. The repertorial totality, the rubrics which were taken were: easily gets angered, anxious about children, easy satiety, desire sweet, aversion vegetables, moist discharge, painful eruptions, scaly eruptions, offensive odor, hot patient. These were the rubrics which were selected, which were mentioned previous also in repertorial totality. And the results were sulfur covered the highest number of rubrics and with the highest evaluation also. And so sulfur was prescribed in the 30th potency. Only 30th potency, 30 potency sulfur was given. And in the first follow-up, which was done after 15 days, the patient had not improved, but so there was no significant changes. Again, the patient was just given placebos and called after another 15 days, where he mentally started feeling better, and to a certain extent, the itching had reduced. Itching had started reducing, and so again, no medicines were repeated, and the sulfur was not repeated, and the patient was given placebos, and he was called again after 30 days, after 15 days, and in that 15 days, there was the eruptions were gradually they had decreased, and he was feeling the sleep was good, the bowel movement had improved. And so with the help of sulfur 30 single dose and maintaining the hygiene, we had advised him to maintain proper hygiene, and that is how the patient was completely, the skin eruptions were cured of that patient. Then there was another case. This is a male who was 18 years old, who was a student, who was studying in college, and he had multiple large hard warts on the dorsum of the hand since last 4 years. And the complaints had started 4 years back, and the patient had done cauterization for this complaints. Twice he had underwent cauterization, and he had developed over the back of the hand between the fingers and palm. Mild pain was there, and was on application of pressure, and multiple condylometer developed over the scrotum in last 2 years. The patient had a history of chickenpox at 4 years when he was 4 years old. The father also had this warts, and the mother had died in an accident before 5 years, and that had affected the patient to a, means in his history also he kept on repeating about it, and it had
Sorry for the interruption. Rajesh sir.
Sir, wait for a minute.
Yeah.
There is a interruption because of the coordinator. I feel she will be soon join us and continue her lecture. So, Dr. Yogesh sir, I believe that the session of Dr. Heena is almost come to the end.
Yeah.
How much time we left with, sir?
Only 2 minutes. 2.5 minutes are there.
Okay.
And there is one question for her. So if within 2 minutes she is able to join, we will let her allow to complete the case. We will guide her.
Definitely. I feel that she is about to end the session because she has explained so beautifully
Yes,
everything.
yes, yes.
So let us wait. She join us as soon as possible, and then we proceed further, sir.
Yeah, we will wait for 2 minutes. Before she joins, there are few questions, and I would like to request the participants that they should mail it to our email ID so that we will forward these questions to Hina madam, and we will definitely come back with the answers to the queries that have been raised here. Yeah, she has joined.
Yeah, can you hear? Am I audible?
Yes, ma'am. Yes, ma'am. Please continue.
So this was about the student. There was a, sorry for the interruption. There was a connectivity issue, and so I got disconnected. So this was a student who had no addictions, and the mental generals were that the patient had confusion and anger marked with irritability with no specific cause. Comprehension was low. He was a workaholic and dissatisfied with other works, forgetful, does not like to take advices. He was pessimistic, sad, and especially after the death of the mother. And he had a weeping tendency with consolation aggravation, and weeps when alone when someone talks about his mother. Then in the physical general, there was a desire for open air like summer, no complaints during winter or rainy season. And the thirst had increased. He desired salt and sweet, and appetite was good. The bowel movement was normal. Then physical explanation, there was a examination. There was nothing found in the physical examination. The local examination, there were warts on the back of the hand, hard, flat, large, some warts irregular in shape, no inflammation, suppuration or ulceration found. And these were the diagnosis, that is, it is wart, and predominantly the miasm, which was the psychotic miasm, and the features of psychotic miasm as explained in mental general. This is the totality of symptom which was formed, the rubrics which were selected, and on that repertorial result, Netromure was prescribed to the patient in 200 potency, one dose only, and for 15 days he was given Seclec. The patient came and reported after 15 days, and no changes in the ward, only mentally the patient was feeling better. And so again the Seclec was continued for 30 days, for a month. And the patient came that new small warts had appeared, and the previous warts were still as it is. Again, Netromure was repeated in the 200 potency. Now, the father of the patient also was coming to our hospital, and so we knew the history of the means he came, at that time the father also came for another complaint, and so we were able to take the history of the father also, and it was found out that he had suffered from gonorrhea in the past, and because of that we changed the prescription of the son. Instead of Netromure, he was given Thuja 1M, followed by Seclec. And in the fourth follow-up, the patient reported no new warts appeared. Generally, the patient was feeling good. There is peeling of skin over warts, dark color changed to a lighter tone, and the consistency of the warts became soft. So again, Seclec was repeated for 1 month. The placebo was given, and patient in the fifth follow-up, he came and reported some small warts disappeared. The remaining were still there. Again, another dose of Thuja 1M was repeated. And on the sixth follow-up, the patient came and the warts had dried and withered with some mark present. Two small soft warts were only left with no change. And so Thuja was again repeated, and in the seventh follow-up, patient came and reported all the warts had disappeared, no new warts appeared, and patient is still under observation with no major symptoms till now. So this was the second case. The third, a female of 42 years of age. She was a teacher, a primary teacher. She is a graduate, and she had a depression of mood with sad thoughts all the time since 8 years. The weakness since 2-3 months. Appetite also not her. Huh? Am I audible?
Ma'am, you are audible.
Okay. Because I cannot see, like, so therefore I was thinking. Okay, so the patient had, as a child, she was like, there were 4 girls in the family, and she was well before 8 years. Gradually, patient started developing depression of mood, sadness, constant lethargy, and weakness. Patient did not wish to speak to anyone. Weakness of memory and stammering gradually increased with trembling of hands. Recurrent oral ulcers since last 5 years. The father also had an oral cancer. Mother suffered from depression. She had 2 children, one female who was of 6 years and a male of 3 years. Appetite 2 meals a day, feels hungry but no desire to eat. Thirst 8 to 10 glasses, urine offensive odor present, stool satisfactory, feels weakness after stool, desires cold drink, aversion nothing specific. She was ambithermal, sleep is disturbed, perspiration foul smelling, and menstruation history there was nothing abnormal except she had dysmenorrhea, And in the life space, patient grew up in a small town with her parents and 4 sisters. She was the eldest among all sisters. Both the parents were willing to have a son, but it was not the God's will. Parents used to scold and beat all the daughters. When patient was 18 years of age, the parents adopted a boy who got more love and attention of the parents than the patient. The patient was intelligent and wanted to pursue her studies but was refused by her father. She felt disappointed and felt bad, but got married at the age of 21 years. Soon after marriage of brother-in-law, the attitude of the in-laws changed as the new girl belonged to a rich family and was a distant relative too. She started feeling neglected and injustice when they were given preference in all the things, and she was criticized for even doing the good things for the family. Her husband also did not speak up for her. The patient started teaching in primary school for money, but situation was never favorable. She also had a feeling of injustice and felt that whole world is in her enemy. She had developed unstable moods and felt too much anger often. Whenever she thought of her past, there is a palpitation, trembling in limbs, sometimes feeling of indifference come. She had fainting spells since last 2 months. She has to manage the house and job both and has a habit of doing things in haste. She feels life is too long and there is sadness and no good thing happening in life. On the physical examination, nothing was detected. It was everything was normal, and she had a major depressive disorder. And the predominant miasm was syphilis, and this is the totality of symptoms which was formed. The reportorial results were mercurius covered majority of the symptoms and the evaluation was high. So much soul was given to the patient and on her mental general symptoms. 30 potency single dose, 4 pills at a stent were given to the patient. And after that, placebo continued. This is the follow-up that in the first follow-up, not much change in depression of mood, anxiety, weakness better, and sleep is better. After few second 15 days, the patient was the depression mood had reduced, anxiety better, physical lethargy, but sleep was good. And then finally, on the that is after almost 5 months, no episode of depression, sleep good, memory is better, and the general condition of the patient had improved. So this is the three antisoric, that is sulfur, antisyphilitic, that is Merxol, and antipsychotic, that is Thuja cases which I have presented. So thank you very much. I'm thankful to B. Jain, thankful to Yogesh sir, and thankful to for inviting me again on this platform and to connect to the viewers. Thank you very much.
Thank you very much, madam. It is our privilege to be part of the learning session. And there are few questions that we will mail you, as there is no time to take up the questions right now, because already we had taken extra 8 minutes for this session. So
Yes.
now thank you. Thank you once again. And sorry that we are not in a position to take up the questions that the delegates have been raised here. So now I would like to invite the next speaker, who is going to talk about mental diseases. The person for whom 90 minutes are equal to 5 minutes, the person who can talk throughout the day on homeopathy in any subject related to homeopathy. So I welcome Manoj sir to take up the podium, and please do start the session.
On screen share. My screen share is visible. Screen share is visible.
Yes, Manoj sir, your screen is visible.
Okay, lovely. PowerPoint is visible.
Yes, it is visible. I request you to just hide this pop-up sign on your PPT.
Okay. What is that sign?
So there is a pop-up sign where you are able to see that stop sharing is mentioned over there in blue box. Just click on hide. Just click on the hide option.
Okay, thank you.
Yes.
So everything is fine now?
Yes, sir. Everything is fine. Please proceed further.
Okay. So thank you very much, Hina madam, for taking us to journey of Hahnemann's looking into practice. Master Hahnemann was far excellent in his observation, in his various induction and deduction both. And probably the 10% spirit of that, if we have, we can see his presence in our practice every day. So I would like to dedicate this presentation to my teachers who taught me this value, which is instilled from the time of Hahnemann to various masters, to our great teacher, Dr. Dhawale, sir. And I'm extremely thankful to both my mentors. I'm also thankful to all students of next generation. Without them, we cannot experience all the theory to the practice. And Department of Ayush, specifically now Ministry of Ayush, for giving us Center of Excellence in Psychiatry. From there, we got a case experiences, trust of community, and reaching up to all of you. I'm extremely thankful to team of 360 degrees, especially to Dr. Yogesh and Yasika, and now Mr. Rajesh, for making our presentation reach up to so many people at the same time. Thank you very much. What I would like to cover today is I'll quickly take journey because Hina madam has explained to us glory of Hahnemannian thinking, feeling, and his philosophy. So I'll take just few minutes for that, and then I'll go to the quick review of what Mansi and Dr. Rajesh has given us. Those who have attended this, their presentation will benefit a lot because then my speed will be much faster for that, and specifically to undergraduate students. Then I'll go to the practice case, which has really profound impact on me of understanding mental disease, how it starts happening to us. And when we see mental disease, how we should go in detail, like Hahnemann in detail. But Heena madam has very beautifully said that how Hahnemann used to observe, how Hahnemann used to look into his practice. This case will demonstrate to us this part of journey of Hahnemann. So I want all of you to listen to my story of the case, but with very great alertness. Keep paper and pen with you. See what are the various things which we see in practice, what Hahnemann said, and are we able to see that? And if we see that, then we can realize that there is a huge possibility of understanding mental disease from Hahnemannian perspective and has a tremendous relevance to modern medicine also. So there is a very beautiful study done by scientists on biopsychosocial model of understanding psychiatry. So this is what I would like to transmit, which I have learned from my teachers, that how study of this model, incorporating modern development in medicine, psychiatry, helps us to understand homeopathic cases in far more depth and detail. The same thing was done by our great teacher, Dr. Dhawale, who has integrated this entire thing of both Hahnemannian philosophy and new modern development in medicine, psychiatry specifically, which has allowed him to reach to a concept of called essential evolutionary totality. So how various susceptibility, sensitivity, diathesis, drama is unfolded in every life and how it needs to be studied in its evolution and in its cross sections. So this, I think I will be able to demonstrate through this case. Then quickly we will go to the IPD cases where psychiatry is really in a bad shape, where patient is absolutely not in his charge, not in his control. And still, if we practice this Hahnemannian aspect, what MLD sir has taught us, we can see cases responding much more better, faster, and truly rapid, gentle, and permanent. Obviously, there are n number of failures, so I'm not going to repeat to this. There are some of the very beautiful, successful case. So if we understand this success, we can duplicate, replicate, and all of us can come together and understand this most challenging aspect of psychiatry illnesses, which is going to be extremely predominant in coming times, specifically post-COVID. So all must understand. And our master was a great, great warrior. He was a lone warrior. But he's this aspect which Heena Madam has already said, I'll focus only on 210 to 230. So how he has perceived this and how it has helped us to see it in the practice. So he has covered acute mental state. He has used word explosion of latent sora, chronic disease, how they are soric in origin and how they travel further. How they are originally corporal in origin. This I never understood in my college days. What is this corporal in origin? Now I am seeing regularly in my practice. So I'll share that aspect with you. And one-sidedness, which is irreversible, no point of return. So many psychiatric cases ends up into asylum where there is no way out. He has covered this into aphorism 215 to 218, corporeal disease and how fatal they are. And they are really true mental illnesses, greatest challenge. We have yet not been able to completely come to the solution to this, but we have ideas and understanding about what is this particular aspect of true mental illness. 221 is mostly practiced by all of us in our regular homeopathic OPD, an acute emotional aspect of expressions and illnesses, and how it is important, very, very important to treat patient at this point. I'll discuss with you this aspect. And aphorism 224, how various living habits, bad practices are affecting our mental health and they need to be corrected. And Hahnemann was very, very brilliant. He organized this from his practice and his observation of society, and we should continue doing that. 225 is again that emotional illnesses aspect of psychosomatic, which is very frequent to our practice. Compared to 225, 221 is much more severe. So they need hospitalization. So we have that facility. I'll talk to you how we handle them in this, how we handle this raving madness with calm, fearlessness, and firm resolution. And not by us only. I'm so glad that we have a nursing staff. A small, tiny girl handles a very, very aggressive human being with some basic humanitarian concern and some basic techniques. We will go into how painful and challenging aspect, what type of compassionate hearing, which is essentially important, how to control loquacious patient and bring some sanity into our own attention as well as transmitting to patient, how to handle indecent behavior of patient. Many of these patients, number of our MD psychiatry student experiences, they have to go under this training, how to ignore this also, how to control this destructive behavior, and how various refusal of medicine. So many patient comes of alcoholic. Wife comes to us with agony. Doctor, please help us. And how to handle him? Can we help him? He's not ready to come for treatment. For him, alcohol is medicine, so he doesn't want to replace it with homeopathy. So we will try to connect, if time permits, up to this point. Let's travel the journey from health to disease. Dr. Mansi has beautifully explained to us about thinking, feeling, action, commitment, and resultant cycle of normal human being, you and me, apparent normality. How do we take action? How do we think? How do we feel? And while we are in this process, we go through certain turmoil. We go through certain type of emotional and feeling and reactivity. And Dr. Rajesh Yadav has helped us to understand how this needs to be observed, panned out, and can be used beautifully into totality, repertory, and mater medica. So from case taking, what Dr. Mansi taught us, to an application, what Dr. Rajesh taught us, in form of various theories, various modern sciences which needs to be understood and applied, which are blessed with that part one students regularly go through this under these two great champion. Through this perception, we will understand how apparently healthy individual lends into most complicated mental disorder. What I'm going to present a case, I think we will be able to understand this. We will also understand master's guidelines and understanding mental disorder. And we will take help of modern medicine to derive model of understanding causation of illness, which help of biopsychosocial model. And finally, MLD says masterly integration of this into essential evolutionary totality. This case, some of my colleague might have listened to it also, because this is very vital case, but those who have understood this case, please attend to this case from this model perspective. This is a case long back from my practice when I had no major idea about psychiatry. But since, like many of my great homeopathic colleagues, if our attention, our involvement in patient makes a lot of people refer us some cases which are very challenging. So this was one of the greatest challenging case which I have seen my early days of practice. And was forced to understand the genesis of violent outbursts. We see outbursts outside, but there is so many processes and volcanic process which goes inside. And for us, this disturbed behavior, which even patients themselves cannot fathom. Remember this. These behavior patients are themselves not very happy about, but they are not in control of themselves. So what happens to our psychology? What happens to our derangement into normal health to a abnormality? Discussing importance of evolutionary history in understanding current state. So when patient comes in this current state, it is very challenging to know history. So with the help of attendant, with help of patient themselves when they are in a lucid phase, it is very important to understand why someone had gone into this, and you need a lot of compassion, lot of patience and listening of the story. Sometimes we have gone through understanding through 8-10 relative different stories, different aspects, and we were more and more confused, and from that confusion something brought clarity called some characteristic physical expression. So understanding mind and body is a continuum. What is expressed even on a stool, type of stool, is critically important for prescription of psychiatry. Type of tongue of antimony crude sometimes can bring changes into this sentimentally upset manic person. So it is very important. Homeopathy is beautiful. It is important to study every tissue, every organ, and every part in its totality. Then only you can understand how body, mind, society helps in understanding the stresses of life if resources are tempered by surgical suppressions or oppressive conduct in the society, or by forceful process which we see, ECT and all the thing which patient goes through and what happens to them is beautifully explained in 215 by Hahnemann, we will see. A married woman in her 40s was brought by her husband, requesting assistance to aid her to come out of her mania. Case was referred by common acquaintance and a strong believer of homeopathy. He said that go there, she'll be all right. So they came with a lot of hope. They had normal marriage life in spite of ups and downs of life. Since few months, she had depression and on and off undergoes psychiatric treatment. She's not complying with treatment properly. She doesn't like those treatment. So this was the point she agreed to come, that this man, doctor, will help him to reduce allopathy. Since few weeks, she has developed aggressive behavior toward husband. She's abrupt, harsh in her behavior, becomes abusive. She turns restless. She turns so restless at night that she moves up and down in room. And typically in Bombay, sometime when someone walks on top floor, when you are sleeping down, it disturbs. So husband was very conscientious. He said that please calm down, don't do this. But she will walk with a strong step on the floor, and only that used to calm her down. And by error, if you try to approach her to calm her down, she hits back and she becomes very violent. She has turned very indifferent to her children, hereby her daughter, son, and beats him on a smallest reason. Recently developed suspicion about husband's affair, becomes aggressive, abusive, violent to the point of beating her. On calming down, goes into severe guilt. Once she becomes quiet, she looks back to her behavior and then she goes into guilt. Friends, this is a little hope for me, because if this insight is there in patient that what I am doing is not so appropriate, itself is a time or a point where we can definitely help these cases with a proper homeopathy as well as some counseling. How low mood and suicidal ideation is affecting her. As homeopath, we are prepared to receive these challenges. Ask yourself, I hope you are noting down. Are we ready? And I'm sharing this case of very early days of my practice. So why I'm sharing that this do visit to us. How do we organize our thought? How do we organize Hahnemannian learning so that we can have more confidence to take this challenge? What is she suffering from? Ask this question as a Hahnemannian homeopath. Why has she ended up into this state? What is the scope and limitation of homeopathy and homeopath? And how to inquire further in this case? Ask this question. Give little thought to this. Why is she suffering? She belongs to, I could finally get through case. Husband was very cooperative. And when patient came, she was also in a little better quiet and receptive form and accepting form, because the referral person was a great friend of her. So she came with a hope that I am helping her to get rid of allopathic medicine. With that intention, she was more cooperative. She belongs to other backward caste and witnesses an abusive alcoholic father who frequently ill-treated her mother. Friends, I want you to be very, very alert. Note down what I am saying. Everything is valuable. Comes from other OBC. Father was abusive, alcoholic, and was abusing mother in front of child. Mother was pillar of strength, but she also suffered from frequent mood variation. And you can understand how a family is disturbed. We are not here to justify or say that because of alcohol, mother is suffering, because mother's mood, husband is suffering. No, our focus is patient. What is she observing? Not our interpretation. She is observing disturbed married life. Though in that disturbance, there is someone who is a strength. One of them was maternal grandmother. She was also suffering from psychiatric illnesses. In spite of all this, she came up very well and did well in her school and college. Please note down. In this disturbed environment, she's still stable. Ambivalence with father was very obvious. She loved him but hated him for his dominating nature, alcoholism, and not attending to family. Many a time she will go on fasting on force. If father doesn't come home, she will do fasting and say that if you don't come home and eat, I'm not going to eat. So she was very, very strong girl who was trying to change a gigantic father. And father loved her, and he used to change for a while for her, but again used to slip into alcoholism. She succeeded sometimes, somewhat, and that built her confidence that she can bring change even in a most aggressive person. Deep within, she was very rebellious and sensitive to rejection. She went on feeling that because of her caste, community, because of her home environment between man and woman relationship, this was inbuilt in her, a sensitivity to rejection. No one can reject her, including her own father or mother or a society. And it was extraordinary sensitivity toward that. She married to a very revolutionary person because she was active in a social leadership. She was fighting for underprivilege. She was heroine in her time, and a lot of boy liked her. One of them was a boy who was coming from Brahmin background. Boy was also having his own issues with health of leukoderma. But at home, stories are different. So they got married, but when she goes to marriage, she stays with husband's family, and she faces untouchability. It's a Brahmin, strong, rigid Brahmin family, and they have gone through problems. I'm telling you story 40, 50 years back, where this was very, very high in nature. I know it still exists. So socio-cultural belief and its impact on evolution of individual. See, it was easy to change society, but when you come to circumstances and only female knows that when you marry someone whom you love, simultaneously it is very challenging to change others. So you have to suppress so many of your emotions, so many of your aggressive leadership quality at home, and succumb to this force so that the balance is being maintained. But this inner insecurity, anxiety, aggression, all when get suppressed to go into this state called somatization. Somatization in a sense of psychosomatic aspect I'm talking, that somatic expressions are balancing our body, specifically thyroid. She suffered from hyperthyroidism, she lost weight, and then she was very agitated, upset, anxious. So there was something because of mind, something because of body, and all we know that hyperthyroid affects mind equally. So mind was affecting thyroid, thyroid's hyperthyroidism affecting mind. See the vicious cycle. How do you balance it? If there is no homeopathy, there are some other ways out. Those days, I'm telling you, they preferred to take one lobe out of her thyroid to make her thyroid balance. And that's how surgical suppression was practiced. I hope you are noting down this very important event. This is not a psychological event, but a physical event which is going to affect the mind. Ultimately, seeing her suffering, husband decided to separate, started saying in UP. Initial days were very happy, but moment she conceived and she had a daughter, they gone into a serious problem because she was not able to cope up. She went into pretty low phase, and she needed a lot of help, and she felt very lonely, forsaken, and rejected. She felt that I am in this state because of my caste, because of my this situation, that people around me don't attend to me. And later on, once she comes out of this, she joins a fighting organization who fights for the woman's right, now counterbalancing. But society, see how various social forces influences mind. We have seen now biological force, depression of grandmother, depression and mood disorder of mother, hormonal disturbance because of thyroid. Now you see what happens because of once body was being treated, operation was done, so body was affecting mind. Now see what happens, society affecting mind. First depression took place because when she was agitating, they were brutally treated by a police force, and so many females' clothes were also torn apart. And this has felt a humiliation in her. She felt that people are absolutely not respecting women, and her entire efforts, she got very, very oppressed, and she felt very dejected, depressed, and that depressed mood and went into a first depressive episode. Now resources of bodies are not available. Earlier there was anxiety, aggression, thyroid was available. This time body opt to go into depression, clinical depression, where there are so many neurological chemical changes sets in the body. She gradually came out with therapy. The second episode took place when she found husband is secretly meeting his own parents. Almost she made a mind that we are separating, so you don't meet your parents. And probably husband has, for making her calm, he said, yes, okay, I'll not meet. But secretly he was meeting for some important work for family. And I can understand as a man that he cannot disconnect from his family completely. But to sake of keeping her mind, he did that. But that has upset her so much that she went into another event of depression. Friends, I want you to be very alert when you listen to this. Look, first episode of anxiety, there was a massive force. Then depression because of social force, though it was brutal, but not as bad as what she has gone into anxiety or a depression. The third force is just a small event, though it is very powerful, but a small event which can be handled by proper communication puts her into depression. What happens further? Recently, she started feeling suspicious that husband was having affair with someone of his colleague. Husband denied this and he was pleading that, doctor, believe me, nothing like this exists. So where is this happening? What is this happening? Earlier, there were powerful events occurring outside you. Now the event starts happening inside you. And she started brooding, weeping, and mood variations, and suicidal ideation, homicidal impulse, and now becomes extremely anxious, restless. So you can answer now. What are the forces responsible? What is her conflict? What are the relationship amongst the family member? What are biological and psychological processes which is she going through? So now you see entire event march what Heena Madam talked about miasm. At the now study at the mind level, study at the body level. That a strong leadership, soric quality to bring change, each to bring change, has gradually gone into an anxiety, a pseudosora, and a tubercular expressions of pseudosora in that reference of inflammation of thyroid and then ending up into hyperthyroid state. Look what happens later on. From autoimmune thyroid now goes into hypothyroid, furthermore into low mood. And hypothyroid is now managed through chemicals. The moods are also managed through chemicals. And what happens is you stay in this psychotic state. But life event goes on, and this march of event takes you to depression, paranoia, and the syphilitic state of suicidal ideation. Friends, are you with me? I hope I have traveled a little faster in this case. But this is what exactly what we have witnessed is called impact of psychological force, social force, and biological force on mental health. Current mental health has been because of these three dimensions. Friend, health also comes through these three dimensions. You can't be healthy mentally all alone. You need to have a beautiful, great psychological development through great parents, great family structure. You should have a good schooling. Same way, a social process which is healthy, communicative, acceptance, encouraging. All this brings mental health. And the most important part is a biological aspect. We are born with certain type of predisposed state, and that also decides our mental health. So this was a great scientist. He has studied on this model somewhere in 95. He was at peak of his explanation of all this entire model to the world. And what is great about this part was that he said that each entity can be relatively autonomous and can be studied individually, psychological process, biological process, and even social processes. And many developmental psychologists have used that stand, which Rajesh has explained to us beautifully. Each entity is also dependent on each other also. All the three are interrelated, and each entity is a component of other levels. So from nucleus, cell, tissue, organ, system, and body as a final or functioning organization for survival. All are integrated process. One can study each unit independently and interpret it interdependently as a continuum. BPS model has a clinical implications. Most disorders, now this case has opened eye. Most disorders from beyond childhood can be classified broadly into this model. The cause of combination of cause of individual is unique in this. BPS cannot be predicted for outcome. but definitely it can give you beautiful idea and better idea of causation of disease. Friends, this model is now helping us to see cases in detail, in depth, and plan our treatment well from all the three dimensions, from miasmatic, constitutional, and acute exacerbation, as well as counseling, group therapy, all the process three-dimensionally important. So the psychology, social, and biological aspect. I talked to you about this. Have a look at it. Now, insight of Hahnemann and integration of modern knowledge too by Dr. M.L. Dhawale, sir. Organon of medicine gives you glimpses of BPS model. Hahnemann was far, far ahead because of his involvement in practice. I will to say only that he was very unprejudicedly looking at the practice. We many times are homeopath trying to justify homeopathy. He was not there to justify it. He wanted to study why human being is suffering. And in that, he came up into such theories which are now organized by modern psychiatry in a much better way. But obviously, the roots are available. So, see this aphorism number 5, where he says, important to study exciting cause of acute illnesses in all chronic cases, fundamental cause, which we are talking about in terms of miasm. In exciting cause, all various social psychological processes are involved, and then patient in his entire constitution, his temperament, his moral, his intellectual character, and occupation, as well as mode of living, habit, and domestic relationship. His personal relationship, his age, sexual functioning, everything put into consideration. This is beginning or root of biopsychosocial model. On further 208, he says that all these factors, all his social relationship, all his psychological processes, and what Dr. Rajesh explained to us about mental state and disposition. Mind must attend to learn if they are obstacle to treatment or required to be directed, encouraged, or modified. All beautifully, if you read Organon from even modern medicine perspective, you see that glimpses which is there in practice, because psychiatry was there before even modern psychiatry came, and he was involved into these cases. So that helped him to build his own understanding of mental health, which is very important. So this is a biological aspect which I have talked to you. I'll go a little rapidly. Then in that we know susceptibility in miasm. All this is there in Organon. Then we see psychological aspect where mental symptoms, state, disposition, coping technique, ego defenses, what very beautifully Mansi, Doctor, and Rajesh has explained. So if you have attended, I'm just going and permitting to go me ahead faster. Sensitivity aspect, a social aspect, which is occupation, mode of living, educational status, sustained disease or health, maintaining modalities, all this social sensitivity he's described about. What MLD sir has done is putting all the pieces together, taking clues from modern medicine, taking clues from Hahnemann, and he has defined vulnerability, which is very important concept in psychiatry. Everyone is vulnerable to mental diseases. What are these vulnerability? What is this susceptibility, sensitivity, and diathesis aspect, which needs to be studied in its evolution? Taking care of understanding from how biology influences susceptibility, sensitivity, how psychology influences, and how socio-cultural factor influences, and integrated everything into this model. Biological factors are like genetic, we see, diathesis, and then study of stresses, which is because of outside you, certain events inside you. Keep this case in mind. You know what social events were happening. You know what was her understanding about herself in coming from the disturbed family setup. You know what stressful family dynamics she has gone through. And she is vulnerable because there is a force behind her in terms of her personal health, thyroid, and her family health in terms of depression and mood disorder and alcoholism in family. All these factors put together, and you can understand how person breaks down in psychiatry. genetic predisposition, childhood trauma, and then all these vulnerable factors ends up into disturbed mental health. So when we study constitution of every individual, no shortcuts to study of mind. Please, if this presentation takes you to understand that there are no shortcuts, Hahnemann has written Organon so that we don't feel prey to these shortcuts. And he writes this. How to study this is in terms of hereditary characteristic, environmental forces, how various setup in which individual comes up, various forces like exciting, fundamental, maintaining, and susceptibility for the disorder. So at the end of each case, we try to study this essential evolutionary totality, a master artwork, a master structuralization by our sir, Dr. Emil Dhawale sir. And I feel that more and more I go into practice, more and more I understand about called essential evolutionary totality, where family, social, work, event outside you, which has been described, the disposition, which has propensity to bring event inside you, in terms of various diathesis, in terms of disease, what I described is being put into one page. So at the end of each case, you should come, then practice looks very simple. If I say that this patient is this much, looks simple, but it needed to go through all pages. Mental illness is a flare-up of a repressed internal dynamics of sensitivity and susceptibility. It is important to study evolution of mental illness with the help of biopsychosocial model. All the three perspectives important: family history, life space events, clinical miasmatic expressions are also important, and evolutionary history from man in health to disease. All this is our insight. I'll go to the totality now. We have to descend down. All this philosophy should take us to close to understanding what is available, the resources which we can tap so that we understand this patient's expression in materia medica language. So if we see this totality, patient is abrupt, harsh in her behavior, cruelty, brutality, all put up all what she is behaving as it is without interpreting too much into things. Very, very all characteristic expressions are important. Pressing pain, heart, anxiety with impending respiratory, better walking. This was characteristic in patient. Don't miss it. Put down all characteristic. Don't keep it in general level. And put last a very important thing which represents patient. What was representing patient was husband came to us that she cannot control, he cannot control her. Moment he controls, she becomes more aggressive and violent. Now this is a very characteristic expression coming out, that her anger, aggression, anxiety, everything gets better when she moves pacing around with a agitation gets descended down. And moment you try to hold her, it increases. Can you convert that into anything? That will bring you close to the prescription. So if you prescribe, if you see repetization, you have kali iode, lachesis, pulsatilla, arsenic. Pulsatilla easy to probably get rid of. Arsenic to some extent is not coming up well, but less definite lachesis and kali iode. Kali iode I have opted for, and various masters have talked about kali iode beautifully. But some recent experiences was very interesting. Here he mentions that in extreme situation, kali iode patient get very irritable, angry, abrupt, harsh, abusive, and violent. The irritability is directly, mainly toward their children, mainly in, I'll say that family members, cruel and quiet to family members. Otherwise, they are very supportive, rebel, and do not do a lot for their family. Exactly, she was doing that for her. They are strong, independent people who takes entire burden of family on their shoulders. She was very much like that. So if we get this connectivity, Kali iode is supposed to work, and it did good job. We could manage to taper off a lot of allopathic medicine in a very short time to help her to be on Kali iode in homeopathy. Kali iode helped her to settle down, but don't be so romantic. Her bodily resources are depleted. Her thyroid was being taken away. She is still dependent on various thyroid forces, hormonal forces. Mood variations are part of her, but not as abrupt, as aggressive, as violent. So Hahnemann's view is very important. Moment you have this explosion, which is being controlled, insanity, mania caused by fright, vexation, abuse, spirituous liquor, or any of these forces, if they are erupting out of that, needs to be handled through medicine like this aconite, belladonna, hyoscyamus. I will add even kali iode in a highly potentized minute doses. She's better now. She's out. Kali iode should be out of our mind from the perspective that now no more she's that. Her thermal, her entire thing now was only simply central line of EET. And there were her sensitivity to rejection and the whole aspect of her explosions which was coming up was from understanding magnesium as a remedy, which helped her to settle far more better. So you can understand an antisoric prescription which Hahnemann talks about needs to be not just all the time some sulfur or antisoric, but antisoric deep acting remedies are very, very important, and that are constitutional remedy, which helps to stabilize constitution for substantially good time. So Macmoore was selected on her basics, which was before her psychiatric breakdown. I will now travel for remaining half an hour to a very rapid journey. I hope you are with me. I'm sure you will have a lot of questions also. But we will travel, and at the end, even if I have no time to answer your some of the question, please feel free to call me or put up message on drpatelmanoj@gmail.com. drpatelmanoj@gmail.com. You can always put up mail and ask questions, and I'll try my best to respond to you. We have made humble beginning. All this I talked to you about genesis of psychiatric illnesses. I talked to you about how common homeopath like all of us can help psychiatric patient if you study this model properly at the hospital, at the OPD level. We are blessed that now we get to treat cases in IPD, and what type of cases which we treat and with what care. So we have given name Anukampa, a word of compassion, and all our staff specifically we are blessed with a staff coming from a military background. He is a head nurse, and he says there is a striking difference between care of homeopath and care there in the psychiatric ward of modern medicine, specifically with ECT and all little bit of chemicals and other things. They says that we are not using chemical, but we are using Anukampa as a very great force along with homeopathy, which is working. So thanks to all team. We all depend on these MD students who brings data, report to us, and we prescribe as a consultant, participating, discussing with them onto all the patients who trust us. We are lucky to have so many patients now that it started in 2014 with 266 patients, and today now we have reached to collective experience of 1242 patients, all when I'm saying hospitalized psychiatric disorder. They are like alcohol related disorders, conversion, suicidal attempt, anxiety disorder, schizophrenia, panic disorder, somatoform, dementia. Now recently we have so many cases of Alzheimer and Parkinson. So in IPD, let's travel to IPD. There is a lot of research done in alcoholism. In previous case, father was alcoholic and disturbance to the whole family. In our practice, we have seen many cases of alcoholism. And alcoholism is illness which will give you fairly good idea about this model. How chemicals, how various influences are affecting our brain and produces disturbance at the psychology level. But the alcoholism itself is primarily because of so many genetic process within you. And it not only changes, comes from in genes, but when you consume, you are now creating new inheritance, which are likely to subject, specifically young Turks comes, 15, 16-year-old boy, they start taking alcohol. Their entire constitution undergo changes. We were studying recently the cases, how, what, any other areas where the cases are studied, because when the next offspring comes from this generation is going to be much more challenge to help. So alcoholism has become rampant. Alcoholism become problem of society, but alcoholism is a medicine for someone. So we have to understand that case needs to be understood thoroughly well from its predisposition, from understanding its genetic influences over drinking behavior, and then furthermore effect on cells, membrane, and eventually causing various membranous dysfunction. Also adversely affects activity of two enzymes, monoamine oxidase and adenylate cyclase, that have important factor in information processing system of the brain. So friends, all this micro detail which is being studied by scientists, we have to put this into practice, that how a withdrawal patient comes to us, how do you handle him, how you study this case, how various forces will help you to study. I'll just show you a small clip if I can go out and show it to you. I'll make an effort. Mhm. Hello, technical support.
Yes, Manoj sir.
I can't go to my hard disk, my computer hard disk.
You need to minimize the web browser
Okay,
and then open your video, sir.
okay. Where is the web? I'm on the right page. Web browser
You
meaning.
are on the webinar platform at present,
Ah,
and just let me turn off your screen on,
yeah, right.
and now you just kindly open the video and then click on the turn screen on option once again.
Screen sharing में जाता हूँ. Okay. Anyway, I think, I can see something. Yeah, I can see. Thank you. Just let me know whether it is coming up well.
Yes, it is coming up very well, sir.
Sound, if
You
it's
can
not
play.
coming, don't worry.
It's okay, sir, but it's appearing very good. You can start the video.
I'm not sure sound is coming, but just observe. Observation is important. This patient was violent, aggressive. There were four people required to handle him. He was going into repeated convulsion, and there were two people handling his feet only. He had restless feet, agitated, excited, and it took time for us to control this entire phenomenon. He went on using abusive word. You will be surprised to know his original disposition. I'm not sure you are getting sound. Are you getting sound?
Unfortunately, sir, it is not coming up. So, but it's okay.
No problem. There is no problem. Aha. No problem. No problem. Now I'm going back to PowerPoint. That is okay. Visible?
Yes, sir,
Yeah.
it is visible.
PowerPoint. Yeah. Good. So this is a major problem. People are coming in this state to us. And alcohol withdrawal is the greatest challenge. And friends, so many people die because of alcohol withdrawal state. I have personally witnessed in this convulsive state, we have lost young life, and you can understand the impact of that on family members. So patient goes through tremendous agony, and relatives so. And this is what alcohol dependence is all about. Makes you really significantly dysfunctional. And then once you want to come out of it, the withdrawal sets in with a very uh, symptoms of in a mild stage from feeling, jumping, nervousness, anxiety, emotionally volatile state, depression, fatigue, and in severe alcohol withdrawal, we have a very uh, disturbing symptoms which comes is a visual hallucination, delirium, and that's why it's a term in homeopathy called delirium tremens. We use that in repertory. So we see that the symptoms appears characteristically on waking up due to fall in mood, blood concentration level, and severity affects the withdrawal. So patient was admitted in this state, was irrelevant talk, abusive, constantly fidgety fit. 4 people required to handle him. Recurrent convulsions, especially during withdrawal. Chronic alcoholic with recent history of binge drinking, gastritis. Now you see the excited state. If you can see, just check it. So this is the state in which he comes to us. We could get history from background history. We got that father was having land owning. Father was also alcoholic, but he stopped recently. In young age, he used to be. So he knows the bad aspect of it. But father was very strong on it that he should not drink, and he was very dictatorial and very hard on patient. He was not ready to understand. Patient was very sensitive. He was playing beautiful flute, painting, music. That is his sensitivity. He fell in love with someone, and he was been handled very badly by father's statement. And one day, what happened that girl committed suicide, and that has created devastation in this patient's life. He was a very sensitive, so the effect of this has been now very powerful on him. That girl's passing away, and he felt that there is no one. And then since then he drinking, sitting in a corner, never reacting to father. Everything was inward, and he was depressed. What was available to him in explosion is all when he drinks. So during drink he explodes out, and then he's been ill-treated during that time. And then now he has went up into a state of binge drinking and followed by conversion. He had a forced withdrawal. He had to withdraw because of this conversion, and we have to do something for him. So we prescribed on available totality, alcoholism, see the whole rubrics which has been chosen, convulsion spasm, restless feet, delusion imagines someone is pursuing him. So as it is, whatever qualified symptoms came to us, I prescribed him on the basis of nux, sulfur, zinc. Why I chose zinc, I'll tell you. There was a nux vomica which was coming up strongly. We had a debate, but I opted for a zinc because of simply background was available to us. That he was not a background where typically nux vomica type of state was there. Rather, it was inward, depressed, and it was being trying to take care of his inner depression. And he couldn't throw or rebel against his father. So, and his fidgety feet with characteristic restlessness, I opted for zinc. And when this is not a result which we get every day, but we dream to have this result. Patient was being under this state in the morning after 2 doses of zinc. When I'm leaving campus, I was personally there to witness this, and he's free of all tying up, and he's communicating. He's telling his story, what happened to him, why this happened to him. He's talking about why he was admitted, his insensibility, he is relating. I wish every time all patient gets accuracy like this and we get this result, even in a bad circumstances. We took chronic totality. Don't be just happy. Acute explosion is over. Zinc was prescribed. And then now comes the chronic totality, which is based on his sensitivity, sentimentality, disappointment in love. Natrum phos was prescribed. And after few weeks, when he comes to us, I'll show you important follow-up. I don't know whether you can listen to me, but there is a subtitle which gives you some idea about how better he is. I've shared my apprehension that every alcoholic says that he has left. He has left in past, but again he comes. He himself admits that. So we go into occupation and help. Physician is identifying himself with patient, says that there are no major difference as a human being. Only thing that I am occupied, I am critically involved in my life, and you have not taken that involvement deep. So you start doing what you love to do, and he was being then directed to start on organic farming. And over a period of time, he followed. Very interesting aspect. This is patient saying most important is this experience, and that is wife. I attended. So we see substantial improvement. So we very clearly see that there is a change in improvement, but don't be so happy. This is called a sleep in follow-up, where patient is better, doesn't report, and then again marriage comes, social background comes, and patient jumps into alcoholism. But friends, this time he gave me a very pleasant surprise. First time in my history, alcoholic after binge drinking admits himself to hospital. Rather he goes to top floor straight. First floor मला admit करा. ते लोगोंनी सांगितलं की पेपर काढा, process करा, and he wanted to get admitted, and he got admitted. We gave him a constitutional straight this time because there were no major withdrawal symptoms, and he took perfect rest and he was out. And then for quite some time he was better. There was a big period of remission. There was no report. And one day I see this boy who was absolutely not helping, non responsible once upon a time, moving with a file. And I asked, "Kunachi file hai? Kiski file hai?" He says, "My mother is suffering from breast cancer and I have come to take her treatment here." And this is a very responsible boy who is back to society, back to his higher purpose of existence. This is what homeopathy can deliver in its totality, if studied from all multiple dimensions and angles of biological forces study properly, psychological, social, and all the forces needs to be handled. Biological forces will definitely help you to understand miasmatic process clearly. Psychological process will help you to understand all evolutionary aspect clearly, and social process will help you to understand how various these dynamics are influenced and re-influenced or can be handled and supported through this social process. So this is very interesting experience to go through. I'll just share with you one more quiz quickly. I have 10 more minutes, I think, the organizers. I'll share one more case with you. In old time, people used to call about typhoid fever, and typhoid goes to head. So now you can understand the whole process of how mind body are correlated and interrelated. That so many illnesses. And friends, I have so many experiences now that when we go into psychiatric illness detail, it is so very important to take family history. One thing, evolutionary history of patients' illnesses, how various dynamics have internalized. Like I had a cases where breakdown was post treatment of tuberculosis. So prolonged tuberculosis treatment, and this after some major stress, this boy ends up into first episode of schizophrenia. And you can understand that till this body was having resources through fight, through immunity, through hormones, through various processes, when this breakdown crosses, then system succumbs to this one-sided aspect of health. So it is very important that anyone comes to your clinic, whether they come for thyroid, whether they come for acidity, ulcer, dysfunctional uterine bleeding, before they are subjected to various process of aggression, surgical methods or anything, please take care of homeopathic aspect. If you can help patient homeopathically, you have saved one more patient deteriorating into psychiatric situation. Obviously, not only these operations or suppressive measures which I'm talking about, genetic backgrounds, so many things makes you vulnerable. Study that, and homeopathy has options. In there are no options, we have to research and bring some options. If we study that these are the area which needs to be handled still more refinedly in a better way, like debate on miasm, quality of miasmatic understanding, all this needs real research. If we are first accepting these phenomena, then we will step forward and understand what needs to be done for our beautiful science, where Hahnemann could do something with his available observation. Now with microscope, now with new modern technology, we have much more reason to be more qualified and quality based homeopath with a quality research, qualitative research, which is called for what Hina madam talked about, inductive and deductive research. We have to put and plunge ourselves into this aspect of homeopathy. This case will also be very interesting to understand what is the power of homeopathy. So the typhoid, which was maltreated, patient was not diagnosed initially, treated with so many multiple drug force, and then ultimately typhoid was detected, but remedy was somehow not working. Spear, every fever spike, she started becoming incoherent, and this has started affecting her functioning, and she became delusional in her behavior. Typhoid has killed so many people after they have gone into a bad state into a brain. One of them was Alexander the Great. It is said that he has suffered from this final stage of typhus fever, where it affects the brain condition. And homeopathy has very beautifully documented all this that I'll demonstrate to you. So patient was brought in early mornings hours, and she had a fever since 10 days, allopathic medicine taken from GP, and then she had developed these mental things, and then she was being taken to Maulana, and Maulana said that luckily, I am very glad that Maulana said that this doesn't look like any jantar mantar or a superstition. This is much more because of some hospital related treatment is required. And she was brought to us. During this, she tried to remove her clothes, saying abusive words. She was picking threads from the cloth. She was talking something in air. She was pointing finger and had a lot of hyperventilation. There were reports confirming typhoid. I'll just show you visuals. Probably you might not be able to have audio. Don't worry. Observation is important. Just observe. Observe. She was abusive, quarreling with herself, shouting, picking up threads. This is the state. She developed fever, was treated with the help of local doctor. I'll just not take a lot of time here now. Bizarre, confusing, delirious behavior, abusive, spiteful, irrelevant, wants to escape. See, if you repeat rice, the remedy comes up is Alzheimer's. She and very interestingly, Boger says, Carphology, subsultus. We read this. It is important for us to open up and find out the meaning there. And specifically when substratus tendinum, when he mentions this is the behavior which is seen in typhoid fever. And this is mentioned in Alzheimer's. Exactly what you see, observe is a state of mind. The results are ought to come after just 2 doses of in word itself. You see changes which homeopathy can bring. She was able to talk about her fever. She could give totality. Not only this, she could talk. From this point, we could complete the whole case. Now, this is very important that this acute prescription was critically important. We could see butterfly pigmentation on our face, the face which is gone through a lot of rough weathers in life. And we are also getting the whole data now. The case summary, she looks weak, fragile, anemic. She basically is a very hardworking lady, but had a lot of exhaustion of struggles of life. And she easily picks up quarrels with everyone. आजू बाजू में किसी के साथ उसका बनता नहीं था. She had a fight with all. Even her children were scared of her because she will be very abrupt and talking to them what she wants to. And she had menstrual complaint with dragging of uterus. मेरे लिए प्रिस्क्रिप्शन का यहाँ कोई डिफिकल्टी नहीं था. I gave her sepia. After sepia, she was so much better. So this is what is the capability of homeopathic, friends. And we have to look for this. I'm extremely thankful to organizers, and I'm open for any questions, Dr. Yogesh, if there are any important questions to be addressed to. Otherwise, I am reaching to the conclusive time of completing.
Sir, there are no questions, so you can still utilize 10 minutes and
So
11
beautiful
seconds.
case. Another biopsychosocial model and case is very important. Huh. This was also very interesting case. Quickly, it's very long case, but I'll try to complete it very fast for you, those who have not seen. This is the behavior of patient. This is the totality. This is something you have to observe and prescribe. Patient do come in this state. And in this case, there was no attendant. I'll tell you importance of attendance history in this case. Patient have gone through a very traumatic experience. And friends, you will be surprised that she is also DEd, a teacher. After her graduation, she did her DEd and she was teacher. And this can happen to anyone. And that's why we should have enough compassion for all of them. This can happen to Hahnemann was also treating one of the first patient was a very noble man. And that noble man turned into an aggressive man. So psychiatry is just knocking the door at any moment because there are so many forces which operates on us. And if we are unable to pay them an end, we may also land up into this type of brief psychotic disorder. She was been prescribed on available data, all typical medicine, veratrum, stramonium for ringing, rhyming, because there was no clear-cut attendance history. And sepia, looking at her butterfly pigmentation. And she was really gradually better in aggression. But we were not getting clue of the deep acting remedy. And friend, clue comes from where? Clue comes from she was admitted for 10 days and she was going to toilet and mother was helping her for a long time. So attendant asked her why she takes, तो बोलती है कि जब भी बचपन से she goes into stress, she develops constipation, and in constipation stools are like ship dung and hard stool. And then we asked what was the childhood illness, and she had a suffering from epilepsy. She was maltreated in epilepsy, and she felt in epilepsy that she is not part of this society. She felt that she has to take care of herself all alone. And some sympathized with her boy, and she got married to him, and she was in a serious trouble in marriage. And then what happened to this event? How it took place? This event took place was a shocking thing. She had only one daughter, and then this was a second son. And son was having 202 fever. She went out to purchase medicine because there was no major support structure. Husband was alcoholic and womanizer. So he was not available to her. She went out to purchase medicine, comes back home and she finds her child dead, blue and dead. And there was a pin drop vacuum in her life. And she was so much disturbed. And you know society. सोसाइटी वाज सेइंग दैट इतना भी अक्ल नहीं है कि ऐसा बाहर से दरवाजा बंद करके जाते हैं, बच्चा मर जाएगा समझेगा नहीं. वी pass loose statements. We don't know what mother is going through. And she has gone through this whole process. So the whole process of her sensitivity to rejections and all the process we studied well, we came to conclusion of magnesium with concomitant of this tool. And a very first dose, and we could see changes in her, and it was transforming change. I'll show you. You might not be able to. She's the same lady. In many seminar I presented, and I presented 3 different videos, also 3 different women. I'll show you the third one after the second dose of magnesium. Friends, this is the power of homeopathy. They literally transform patient if they are connected properly. And each case needs to be studied from all these 3 dimensions of biological, psychological, and social processes. If you are accurate of these 3 circles, then in between, what is in center as a mental health is for sure guaranteed. Thank you. Thank you very much. Thank you. Thank you. Hello.
Hello, sir. Thank you very much for a wonderful session for showcasing the participants the scope of homeopathy in psychiatric cases, and the homeopathic physician needs compassion, anukampa, to deal with these kind of cases with the model that MLD sir had shown all of us. We are speechless. I think the same status is with the delegates also, because the responses that I had read are too good in terms of what kind of scope you have demonstrated, and the guidelines that you had given us, and in what way we can deal with the psychiatric cases, especially the first case when we were going through. Today is a International Yoga Day, and I was literally feeling that I am going into a stage of trance, and the manner in which you had presented was too excellent. So I thank you on behalf of BJN team to both the speakers for their wonderful experiences that they had shared with us, and in future we would definitely like to have both of them on the platform. So if anyone is having any question, they can, I have mentioned the email ID of sir, so they can contact sir for questions. And I had shared one Google form link for generating e-certificate for the participants. They can fill up the details and they can get the certificate for the today's session. Thank you once again. And tomorrow we are again having 2 different speakers with us, who are going to deal with the 2 topics that I would like to mention with you. Just a moment. With the presentation, I was so much lost that I have forgot to open up the link for tomorrow's session. I would just, in a second, we have time, so I will. So tomorrow we are having a presentation on Materia Medica by by Saptarshi Banerjee sir, behavioral Materia Medica of Apexians, Mr. Naksomika and Mrs. Magnesia Karp. And the second speaker is Dr. M.K. Sahani sir. He is going to deal with unifying concepts of organ of medicine and repertory for chronic cases. So see you again tomorrow. Thank you very much. Thank you, sir.
Thank you very much.
Blessed with your presentation. Both the speakers had done an excellent job.
Thank you.
We were mesmerized with the presentations. Thank you very much.